as a nurse in this industry specifically, like I used to work in a pain clinic. So every single patient that came in to me was in pain of some sort. So I started a ton of IVs and just those kinds of things. So my goal in that was always to start their IV without creating more discomfort than they were already in. So it's kind of like that whole needle working. But it was, sometimes you almost take on their emotions or their, I mean, the reality is that nurses and doctors typically get into the industry because they want to help people. And therefore, maybe you're more empathic, or you just like can take on things that maybe aren't yours. And in the aesthetic industry, like these patients or people are coming in because they just want to feel a little bit better. So you might take on some of their stuff, but a little bit different way. So when you get to really treat them, you are there to really help them. So maybe you're just doing a consult, or maybe you're doing a little bit of Botox, or maybe you're doing a little filler, or you're referring them somewhere else, but you're really just treating them. Like you're not worried about anything else. And I think the other thing is like the stress level. Like, of course there's stress in any kind of healthcare. Maybe you have a patient that reacts to something, or, you know, has an occlusion or something that can, I mean, there are things that can go wrong. So you can lose sleep over patients, but typically, you know, you're not having somebody die in your care. And so in this industry, it's just less stressful. Whoever your people are in your life, I think that you can radiate differently because you're not stressed out. Like I have friends that are nurses in like trauma, or nurses in like sexual rape victims, you know, like those kinds of things. And the emotions that they take on, or the things that they see, and God bless them, like I'm thankful for them that they can be in that industry, but I think you can only do that for so long before you feel like I need to do something else, because it's emotionally draining. And I think that then affects your entire quality of life, because maybe you're working long hours and it's emotionally draining, and now you're trying to be a parent at home. Like, what does that look like long term? The income potential as an aesthetic provider is honestly endless. Like there's so many different opportunities for you to make a great lifestyle. So whether you're working 4 hours a week or, you know, 40 hours a week, like you get to really adjust what you want. A lot of injectors, a lot of aesthetic providers are paid on commission. And so you get to earn as much as you put in. And so I think that aesthetics, actually I know that aesthetics, it is like the best kept secret as far as nurses go.